So today is guided surgery 2. So this is kind of more of the advanced course. I've seen a number of you guys, some of you guys have experience. Some of you guys came to the first course. The first course really had a lot of the basics, the nuts and bolts. So if you feel a little bit lost, you can go back, get access to the first course. We're not going to spend as much time today doing, intro to guided surgery and like the fundamentals. But we're going to try to jump in and add on and stack on top of that, so that we can start build on some of the cooler stuff that you can do. And then some of the more like, specific tricky areas that I get texts and calls about, we're going to try to dive in so you guys feel confident when you get those cases that aren't just a simple number 30 with the tooth already missing and there's plenty of bone and everything is easy. We want to think about a little bit of the more challenging stuff, the actual more day-to-day things.
When
so that
going through the hands-on, just wave me down if you're lost and you didn't come to the first course. I'll come over and we'll do some one-on-one.
Yeah.
So we'll get everyone to the same speed.
Yep.
We'll tinker together.
Yep. And then we're going to talk about the prosthetic side of dentistry too, and how we can start thinking about a little bit more advanced prosthetic use, so like immediate temporization, immediate loading. So we're going to kind of jump into that, and we got a full day. So we do our series is kind of a 4-course series that we put on. So I'll run through kind of the topics. We just finished, guided surgery 1 and 3D printing, all the basics of like how do you 3D print, get a surgical guide going in office. That's kind of our intro course. So that was in January. We just finished that one, but we'll be back up again January 23. So we can give you guys access, and you guys can get availability to the first course recording, or you can come back in January 1st live. So a lot of intro stuff. This is today's session. So this is the second course. We're going to be talking a lot about guided prosthetics, custom healing abutments, tissue shaping, some of the tougher, more challenging surgical guides to do. We're going to talk a little bit about how you can do some simple guided sinus lift. We're going to talk about the guided sinus lift kit today, do some simple sinus bumps. We're going to talk about these custom tissue healers. So these have been a big part of our practice, really getting really nice prosthetic results.
And we stopped using healing abutments.
Large percentage is custom shaping. So we're going to talk about cases like this and how do you get really nice emergence profiles.
We don't even stock them anymore.
Yeah, we kind of stopped buying a lot of the healing abutments. And then the third course is kind of the more advanced restorative side. So we talk how do you do your own digital wax ups, whether that's for surgery or whether that's for crown and bridge. And then how that applies into dentures. And so how do you prosthetically put teeth where you'd want them and then make your workflow follow that. We throw night guards in there. We do a lot of in-house 3D printed night guards. That's a great, just simple bread and butter service for patients. And then digital dentures, kind of how do you merge the analog and the digital workflow to get really, really nice results. Pretty cool watching like the world of digital dentures. It's always been like, that question is like, how do you capture the vestibule, right? We can scan solid objects, but when you got moving objects like vestibules, how do you capture that? And so a lot of it's just kind of marrying the two, the analog and the digital workflow, and you can get some really cool results. I mean, some of the, if you've messed with digital dentures or milled dentures or printed dentures, sometimes you're like, wow, the fit of this against the tissue is just different than what I'm used to. There's just it's a lot more accuracy. And then our last course is kind of like the finale. This is where it gets into the really, really big stuff. So the all-on-X, the hybrids, the work, how do you plan a case? How do you plan the case digitally on the surgical side, on the restorative side, kind of start to finish, from planning to surgery to prosthetics. Really, we enjoy this. This is a big part of what Dr. Borisov and I love to do, is just think about the big cases and how we can bring digital into that. So we talk about 3D printed temporary hybrids to load patients in, and then putting the pink on, staining, glazing. So we go through all of that in our final course. We talk about types of like final restorations that we like. This is a thimble bar restoration. Obviously a lot of different ways to restore hybrids. This is one of our favorites, and ultimately the goal is to get, digitally planned so, your screw hole accesses are in an ideal position. And to nail that, right in the perfect, pit and groove and cingulum screw hole positions in an analog workflow is just, requires a little bit of luck. Digital can help with that.